Greetings, dears. This is Annette of AnnetteLeonard.com, back again with Chronic Wellness. Thanks for joining me. I am starting a series today talking about alternate therapies. Those of us who have been sick, not even for that long, oftentimes find ourselves frustrated, disappointed, disillusioned, or maybe even not beginning with allopathic, or as we know it, traditional Western medicine from jump. There can be a variety of reasons why the modalities of Western medicine aren't working for us, aren't our first choice, maybe weren't even what we were raised with. And from discrimination to expense to lack of trust to lack of seeing results, there can be a whole array of reasons why that is not where we seek care or treatment for our diseases, our pain, our sources of illness. And from diagnosis to treatment to long-term care, there are a wide array of therapies that are considered alternate, but for many of us might be primary. And over the course of the coming weeks, I'm going to talk about several of these. And as ever, I'm really eager to hear from you, either on my website or on Instagram or here in the comments section about your experiences with these and other modalities. So I'm going to start things off by talking about acupuncture. Acupuncture is a traditional Chinese medicine practice, and it relies on following the force that is qi, the life force that is qi throughout the body. And there are meridians or pathways that qi follows in our body. And a skilled practitioner can usually read our qi in a variety of ways, but oftentimes begins with a detailed study of the pulse. And, our pulse is often taken at the doctor's office. And typically what's being assessed is our beats per minute of our heartbeat. But a Chinese practitioner is assessing so much more. Someone who is astute in Chinese medicine can read things like the condition of our organs and which organs need particular attention and the strength of our qi in those various organs just from spending time at one of our wrists inspecting our pulse, which is indeed an amazing thing to behold when we've been taught here in the West that all you can detect from a pulse is one's beats per minute. And then it is typical for one to take off some amount of clothing. Oftentimes for me as a woman, that has been stripped down to your underwear and bra and lay on a table comparable to like a massage table and have a series of very, very thin needles that are usually quite long inserted in specific points in the body tuned to address what is out of balance. And not being a practitioner of Chinese medicine, I never know what those points are or specifically what they are meant to address. And sometimes the points can be in your ear or on your face, and then anywhere on, your chest, and sometimes legs or feet, sometimes in the belly. And then those needles are typically left in place for a length of time, usually less than half an hour, but maybe 10 to 20 minutes. And then you're left just to relax on the table, usually alone in the room. And then the practitioner comes back, attends to those needles, and sometimes there's a small amount of manipulation in the needles, and then the needles are removed. And it's typically a pretty benign experience in that there's not a lot of pain. Occasionally, upon insertion or when there's a little manipulation, I found some discomfort, um, but but no excruciating or tremendous amounts of pain. Uh, Relaxing on the table with quiet music and turned down lights was, of course, quite relaxing in the waiting. And oftentimes, people are recommended for a particular situation in their life to do a series of treatments. And maybe it's sort of 8 to 10 over the course of 3 to 4 months, etc. And people can see an acupuncturist for fibromyalgia, for back pain, for issues around insomnia, and a wide variety of other conditions. So, particularly if you have pain conditions and you haven't investigated acupuncture, it might be something to learn more about. I can't speak to what treatments in your area cost, and whether or not it is at all covered by your insurance. It's often not. But in my area, I was able to find a practitioner who had group treatment rooms where 4 to 6 of us had treatment tables all in a common room, where we were asked to only pull up our pants to the knee and pull up our shirts to expose our bellies or our arms, but not fully disrobe. And then we could be in a common treatment room, and the practitioner could then offer a really affordable rate rather than having private treatment rooms and individual, door closing kind of situations. And so you might look up community acupuncture to see if something similar is available to you, if paying a premium price like $75 or more per session would be cost prohibitive. For me, my chronic fatigue syndrome became so eclipsing that my energy just really could not sustain acupuncture treatment for a period of time. And I'm now on blood thinners, and having any kind of needlework means that I'll have bleeding and bruising. And so I don't currently go to acupuncture, but I did find it energizing. I did find that there were ways in which it addressed and alleviated pain. And it certainly was a relaxing time out. And I did find energetic benefits from going to acupuncture. So that's a bit about acupuncture, and I wonder about your experiences, or if you have more details to fill out the picture of the ins and outs of acupuncture. And as ever, hearing from you matters to me. And we'll continue this series about alternate treatments next week. So until we're together again, I hope that you are finding meaning and beauty, and that there are ways in which the changing of the seasons are contributing to your wellness. I love you, and I'm thinking about you. And until we're together again, be well.